I'm Dr. Jeffrey Whitman from Dallas, Texas at the Key Whitman Eye Center, and I've been implanting the crystalens since it was approved by the FDA. And right now I've planted approximately 3,000 of the lenses, and currently I'm really enjoying putting in the new Five-0 lens and have had a lot of success with it. In this video, I will be describing what I consider the optimal points of crystallen surgery and lens insertion. For most of my crystallen surgery, I prefer peribulbar anesthesia. I find this gives me more control and makes the patient very comfortable. To begin with, I like to mark the dry cornea with a 6mm optical zone marker that I use for a template for my capsulorhexis. When I start the case, I like to put some OcuCoat viscoelastic on the surface of the cornea. I find this moisturizes it for almost the entire case. I then prefer to make my main keratome incision next with a 2.8mm keratome. Then I prefer to make two small paracentesis incisions on either side of the main wound. Next, I will fill the anterior chamber with viscoelastic to protect the cornea. I then use a bent-tipped cystotome to begin a 6mm capsulorhexis following my template. I find with the new Five-0 lens that we stay away from the smaller capsulorhexis size. I prefer 6mm or more when I tear my capsulorhexis, and I keep it round. After the capsulorhexis, I proceed with good cortical cleaving hydrid dissection, and then proceed to phacoemulsification and irrigation aspiration of the rest of the cortical elements. I believe with the crystallens it's very important to clean the posterior capsule. If you see any posterior cells, go ahead and polish them. I prefer a silicone polisher, and I'll even polish the underside of the anterior capsule leaflets. Next, I fill the capsular bag with viscoelastic, and I insert the Five-0 lens with the MTC injector cartridge provided by Eyeonics. Now let's take a look at a few examples of lens insertion. I insert the injector through the 2.8mm incision. It's a little bit of a tight fit, but I go slow and inject the lens until the body of the lens is out, and then you use the tip portion of the injector to inject the entire lens into the anterior chamber. Then I take a second instrument such as a Conner wand, and simply by pushing the lens inferiorly away from the surgeon, I can pop the both haptics into the capsular bag. I always rotate into the 12 to 6 o'clock position. I'll remove viscoelastic from underneath the lens and over the lens. And then I seal the paracentesis and main corneal wound and make sure that the lens is in its posterior position. I begin to inject the lens with the cartridge. I wait for the full body of the lens to go in, but you can do this as a one-step technique by positioning the trailing haptic as it comes out of the injector into the capsular bag, as you see. I then move the lens into position. I perform irrigation aspiration to remove the viscoelastic both behind the lens and in front of the lens. I hope that you found this video useful and that you will enjoy inserting the crystallens Five-0.